up guys? I'm gonna report about the Pneumocystis pneumonia. So Pneumocystis pneumonia is a serious infection caused by the fungus Pneumocystis cerevisiae. It's a form of pneumonia that is caused by yeast-like fungus Pneumocystis cerevisiae. It is also known as PJP. For Pneumocystis cerevisiae pneumonia. So scientists have changed both the classification and the name of this organism since it first appeared in patients with HIV in 1980s. Pneumocystis cerevisiae used to be classified as a protozoan but is now considered a fungus. Pneumocystis pneumonia or Pneumocystis cerevisiae used to be called Pneumocystis carinii. Yes, when scientists named P. carinii to P. cerevisiae, some people confuse Pneumocystis cerevisiae pneumonia is still abbreviated PCP. PCP. So, the symptoms of this disease are fever, cough, difficulty of breathing, chest pain, chills, fatigue, and tiredness. So Pneumocystis pneumonia factors PCP usually happens in people who have had an organ transplant, who have HIV, who have blood cancers, or who take certain drugs for autoimmune disease such as rheumatoid arthritis, inflammatory bowel disease, and multiple sclerosis. The other people who get PCP are usually taking medicine that lowers the body's ability to fight germs or sickness or have other medical conditions such as solid organ transplant, blood cancer, inflammatory disease, or autoimmune disease. For example, lupus or rheumatoid arthritis. So stem cell transplant. So how to prevent this kind of disease? There is no vaccine to prevent PCP. Yes guys, there's no vaccine to prevent this PCP. A healthcare provider might prescribe medicine to prevent PCP. For people who are more likely to develop the disease, the medicine most commonly used to prevent PCP is called trimethoprim, sulfamethoxazole, TMP or SMX, which also known as cotrimoxazole, and by several different brand names, including Bactrim, Septra, and Catrim. Other medicines are available for people who cannot take TMP SMX. So medicine to prevent PCP is recommended for some people infected with HIV, stem cell transplant patients, and some solid organ transplant patients. Healthcare providers might also prescribe medicine to prevent PCP in other patients such as people who are taking long-term high-dose corticosteroids. Yes. So what are the sources or what's the source of this disease? So PCP spreads from person to person through air or airborne transmission. So some healthy adults can carry the Pneumocystis pneumonia or fungus in their lungs without having symptoms. Yes, without having symptoms, and it can spread to other people, including those with weakened immune system. So many people are exposed to pneumocystis as a children, but they likely do not get sick because their immune system prevents the fungus from causing an infection. In the past, scientists believed that people who had been exposed to pneumocystis, yes, as children could later develop PCP from that infection if their immune systems became weakened. However, it is more likely that people get PCP after being exposed to someone else who has PCP or who is carrying the fungus in their lungs without having symptoms. So diagnosis and testing for this disease, PCP is diagnosed using a sample from a patient's lungs. The sample is usually mucus that is either coughed up by the patient, called sputum, or collected by a procedure called bronchoalveolar lavage. Sometimes, a small sample of lung tissue, a biopsy, is used to diagnose PCP. The patient's sample is sent to a laboratory, usually to be examined under a microscope. Polymerase chain reaction (PCR) can also be used to detect pneumocystis DNA in different types of samples. A blood test to detect beta-glucan, a part of the cell wall of many different types of fungi, can also help diagnose PCP. So treatment, what are the treatment and outcomes for this disease? PCP must be treated with prescription medicine. Without treatment, PCP can cause death. Yes, of course. The most common form of treatment is trimethoprim, sulfamethoxazole, TMP or SMX, so which is also known as cotrimazole, and by several different brand names including Bactrim, Septra, and Cotrim. This medicine is given by mouth through a vein for 3 weeks. Yes, the TMP SMX can cause side effects such as rashes and fever. Other medicines are available for patients who cannot take TMP and SMX. So what are the 3 types of pneumonia and how to treat them? So viral pneumonia. We have 3 types of pneumonia: the viral pneumonia, the bacterial pneumonia, and the mycoplasma pneumonia. So for the viral pneumonia, this is most commonly caused by other viruses such as the flu, but can also trigger by bacteria. Viral pneumonia can be transmitted through fluid after someone sneezes or coughs. Some types of this strain of pneumonia include dry cough, fever, shortness of breath, and possibly pain in the chest when breathing. The most common treatment of this type of pneumonia is antiviral medication, as well as symptomatic treatment. So for bacterial pneumonia, this type of pneumonia is found in the lungs and is caused by bacteria, the most common being Streptococcus. Bacterial pneumonia often occurs in people over the age of 65 as well as in people with asthma or heart disease. Much like viral pneumonia, it has symptoms that include high fever, green and yellow mucus, and chills. Antibiotics are the most frequently used way to treat bacterial pneumonia. So the last one, mycoplasma pneumonia, commonly referred to as walking pneumonia. This is a less severe type of pneumonia which is often confused with a cold or flu. This type of pneumonia has symptoms such as sore throat, headaches, and tiredness. So antibiotics can be used for treatment. So prevention tips: wash hands. Wash hands well and often. Pneumonia is spread quickly through coughing and sneezing. So drink a lot of fluids and eat right. So follow good sleep habits to keep the immune system balanced. Stop smoking. Stop smoking. Get flu and pneumonia shots. So that is all for the Pneumocystis pneumonia. Thank you guys.